Tonight, we welcome back for the first time Chelsea Anderson. She's a registered provisional psychologist with the College of Alberta Psychologists, and for the past 2 years, Chelsea's been working under the clinical supervision of Dr. Lauren Walker, specializing in couples counseling and sex therapy. Chelsea has a special interest in working with cancer survivors and spends some of her time working directly out of the Prostate Cancer Center. And I can't believe we haven't met before, Chelsea. In any event, she couldn't make it on her original scheduled date, but she's here with us now, so let's give Chelsea a nice warm prostate welcome.
Okay, so I am here, I have to remember to stay in front of the camera, this evening to speak to you about, well, the title I've called it is Navigating Sexual Relationships After Prostate Cancer. I'll tell you a little bit about myself, some fun facts, and why maybe I am here presenting to you, a 30-some-year-old woman. So a little bit about me. The reason I was unable to come in March is because I sustained a concussion while mountain biking. So fell off my bike and hit my head and couldn't work for about 6 weeks. So that's why I was not here. Thank you for having me back. I grew up in BC. I've been practicing as a therapist since 2018. I started out my career in sexual assault trauma, and I'll get a little bit more into that in a sec. But I've worked around the world in Phnom Penh, Cambodia, and El Alto, Bolivia, working with not-for-profit organizations that are already established, helping women get out of the sex trade. So I've been in the area of sexual health and wellness for quite a few years. Another fun side of my practice that I'm starting to grow is sports performance. So I'm working on my sports psychologist side, working with high-performance athletes on mental performance. And so I've just got a few of my racing pictures up there. I'm a competitive mountain biker, as I said, and road biker. And then there's a picture of our 4-year-old English bulldog, Rogan, who is 65 pounds of bricks. And we love him dearly. So here's our practice, Walker Psychological. Sorry about some of the typing in there. I created it in a different program, but that's okay. So there's 3 of us practitioners at Walker Psychological, the clinical director being Lauren Walker, obviously. So like I said before, I started out my career in sexual assault trauma. As you can imagine, that's quite heavy. I didn't want to spend my entire career there. But what I did notice was there's something really empowering about knowing how to talk about sensitive topics such as sex and relationships. And I also noticed that there wasn't really space to be able to have those conversations that weren't maybe hypersexualized. And so I started to cultivate this interest of, okay, there's something here that feels important to me. And so a couple years ago, when I was considering moving to Calgary, this opportunity to work with Lauren came up, and I connected with her, and we decided that we were a good fit for each other. And I joined on at the time it was just me and her, our small practice. And then Selena has joined us this past September, so it's almost been a year. But you can see I've kind of detailed there if you're interested to know myself. I specialize in sex therapy, relationships, so I work with couples, men's health, specifically with prostate cancer, and transgender health issues as well. As Brad said, I work out of the Prostate Cancer Center 1 day a week on Fridays, and I've collaborated with them, and we present a workshop once a month for whether it's for couples or for caregivers, depending on level of interest on that particular day. Also have Selena, one of our other counselors in our practice. She specializes in women's health, so focusing on pelvic health and fertility, menopause, pain rehabilitation. She is also an RMT, and then anxiety, stress, and depression. So the 3 of us, we're quite specialized in our field and are all really passionate about what we do. So what I'm here to talk about today is we believe that while cancer treatment may impair sexual function, sexual activity and sexual relationship doesn't need to end after a diagnosis and after treatment. And here's I've got a little overview of what I'll be discussing today. Maybe it's things you already knew. Hopefully it's some new things. And then ending with maybe a little plan of action and time for questions if there are any. So the approach I take to counseling when I'm working with folks, whether it's individuals or couples, whether it's in sexual health and wellness or sports psychology, is a biopsychosocial model. So when we're looking at that, what that really means in terms of our sphere here is that there's a sexual component and maybe there's symptoms of the sexual relationship component, but that never happens in a vacuum. There's always other things that are influencing or impacting our experience. Things such as, developmental age, things like the interpersonal relationship with our partners, our previous experiences, so maybe family history growing up. All of these different areas can impact the way that we experience sexuality and the way that our bodies will show up in those spheres. And so another maybe a little bit more succinct way that I can present this, I guess, is these 4 quadrants. So when I'm looking at the biopsychosocial approach, we're looking at the biological, how does our body show up in a certain situation? What are we experiencing somatically? The psychological aspect, what are maybe some emotions or cognitions that are happening as we're experiencing something, not necessarily in sex in all areas. Social cultural, so with that piece, we're talking about the wider social context. What are maybe some belief systems that we've been brought up with, or messaging that we've absorbed as we've grown, and then the third piece, this interpersonal piece of the relationship aspect between two people. So I've kind of highlighted there the 4 different quadrants. So we're talking about biological changes in the body, specifically with prostate cancer, loss of a body part, that prostate, or changes in the function of it. The biological factor as well includes changes in sensation from a physical standpoint, experiences of pain, and experiences of fatigue. The psychological component, as is outlined up on the slides here, the emotional aspects, the cognition, so body image, negative thoughts about how our bodies are performing or how they present, and motivations as well for taking action towards change. Today I won't be focusing quite as much on these biological and psychological pieces. Not that they aren't important, but generally your physicians or urologists will be taking care of the biological component. Having said that, I'll briefly go over some erectile treatments that we see as being effective and are very common. Again, I am not the physician, so I'll leave that up to them, but I like to touch on them just so people know. The social cultural piece here. So again, we're looking at, there's a lot of religious belief systems that can impact and shape what we think, or the beliefs we have about what sex should look like in a relationship, and how we approach it, or how we talk about it even, and cultural values. So I like to think of every kind of family as their own little culture pod, and families everywhere have different cultures. So what are the family values maybe that we were taught growing up that might influence these elements of our belief system, and as well as social norms. So what is everyone else saying? How are other people talking? When it comes to the sexuality piece, I know there's definitely a specific culture that people think of when they think of hockey teams, locker room talk, football teams. There's a very masculine, a lot of bravado in those situations, which does affect how men view themselves in terms of sexual function and relationship. And the final piece here that I'll talk a little bit more about today is the interpersonal, so the relationship piece. When there are ruptures, when there are disagreements or misunderstandings in the relationship, from a libido aspect, if there's a mismatch of interest in sexual activity or connection, the fear of intimacy or fear of, you have it, your body has changed now, so how do you go about, doing the things you used to do? How do you do anything different? Is there anything different to do? And then that lack of communication, so the impact that not knowing how to talk about things can impact the relationship as well. So going on to just a brief overview of erectile treatments. This is probably a review for a lot of you, maybe some new information there, but generally we'll look at these four, there's another option, 5 options in terms of erectile treatments. So looking at the oral medication, Viagra, Cialis, Levitra, those are kind of the common oral medications that will perhaps enhance erectile quality if there hasn't been any damage to the nerves. That would be prescribed by your physician. Also looking at injections, there are a few different kinds of injections that can help blood flow and increase the rigidity as well. And then there's other devices that can also be used, such as a vacuum pump or a prosthetic as well. And those would be the vacuum pump. We emphasize I've had some patients acquire some from suspicious sources, and so I do encourage. There are medical grade vacuum apparati, and I advise having a medical practitioner instruct you or demonstrate how it works properly, so that you get the best results, and also there's no harm caused. Dr. Lornmacher usually will do the lessons or teach someone how to use that device. And then a prosthetic, that would usually be an option if there is no erectile quality whatsoever, typically after a 4-year period of recovery after a total prostatectomy, and that would be something that a urologist and surgeon would be able to talk you through and talk about how that works and the benefit that it could be. So moving into this piece about beliefs and awareness of beliefs. So this sociocultural piece, people often will have beliefs about themselves and their sexual relationship and sex. A straight man may think that his partner will not be satisfied unless the partner have intercourse. Perhaps a same-sex couple might be worried about not satisfying one or the other couple if they can't be in a position that maybe they typically would. And so beliefs or assumptions like these can often leave men and their partners feeling isolated, unsure how to keep intimacy going, especially if erection or intercourse has been something that they've relied on in a relationship. And so I've just got on the screen here a few examples of maybe beliefs that I've heard from patients, and just below that some ways of reframing the frame of thought. So the first one there, as a man, if I can't have erections, I can't satisfy my partner. And maybe a reframe of that concern would be, I could ask my partner what their needs are and how to please them in other ways. So with that one, the underlying message there is, okay, there's different things that we can do, that you can access, and it's not a bad thing to ask a partner, what is it that they think? It's not up to you to anticipate. It shouldn't be up to you to anticipate their needs. The second example I have up there is, what if my partner thinks I'm not attracted to them if I can't get a firm erection? I hear this one so much. It's so common. The assumption that a firm erection or adequate erection is a sign of either attractiveness of their partner or arousal levels, which that's what's a lot of in culture, is that assumption. But being able to reframe and re-understand this idea that you can reassure your partner that you are attracted to them, you do enjoy being physically intimate and close with them. Erection has it has something to do with it, but it's not the only way. There are other ways that you can show attraction and other ways to be physically intimate, and I'll get to that in a few other slides. So I've got another list here of other beliefs that I hear quite commonly from my male patients. You may or may not relate to some or all or none of them. But I'll read through them here briefly. So this first one, it's a man's duty to perform during sex, which in my opinion sounds like a lot of pressure. So take responsibility for that. The second one, good sex is spontaneous and natural, with no planning and no talking about. I hear that one very, very often. Men who are not capable of having intercourse with their partner cannot satisfy them. In sex, reaching climax or orgasm is the most important part. Medication should give me a firm erection whenever I take it, or else it isn't working. And then this last one, foreplay is only the build-up to intercourse, and there's no other reason for it. So these are common things. Maybe you can relate to some of them that I'll hear from clients, and in the course of therapy, there's often, we can unpack them a little bit, and sometimes these beliefs are holding a person up or creating barriers for engaging in a relationship or intimate relationship with their partners. So here's a note on communication. So whenever I mention, okay, let's talk about communication with couples, there's almost an audible, like visceral sigh or eye rolling of like, oh, communication. We've been married for however many years, Chelsea. We know communication. I'm like, okay, I understand. We know how to communicate. I mean, whether it's effective or not is another thing, but right? Okay, good. So when it comes to communication and a sexual relationship, I am sure many of you have had to work to maintain a relationship, whether it's been due to the prostate cancer journey or due to other things, especially when there is kind of a change in body, whether it's a lack of erection for yourself or maybe there's been changes in your partner's body. And this often, or you may have experienced increase in frustration towards your body and to sex, because you have to make this adjustment, and it's hard mentally to be able to do that. So couples who do not communicate about these changes that occur in a relationship can end up withdrawing from each other, or maybe not wanting to burden their partner with talking about things that they're struggling with, like their emotions, which really ends up being a disconnect, and one or both partners feeling isolated. And so men who are not feeling close to their partners, let me start that again. What we've noticed is men who feel closest with their partners during sex before prostate cancer. So, that being, sex is a place where they feel really connected. And from there, they feel that emotional connection afterwards or during. When sex is the primary means of feeling connection, after prostate cancer, when there are changes to erection quality, often we'll see men withdrawing emotionally, and they'll also notice maybe some diminished desire because they don't know how to navigate. And then again, both partners end up feeling disconnected. Both partners can end up feeling less wanted and less attractive. In contrast, some couples find themselves even more connected after the cancer experience. And some report being perfectly fine with no longer having intercourse and still are able to maintain a intimate, emotional connection in their relationship. And so I like to highlight to folks, just because maybe sex isn't part of the relationship anymore, if that's something that you've agreed upon and it's not an issue for you, great, then it's not a problem. Even though maybe everyone else around you is saying, you should get help for that. If it doesn't bother you and it's something you've agreed on in the relationship, great. Then that's a great thing. So to follow that up, in context of low desire that I mentioned earlier, when we're not feeling this desire to connect, or are hesitant about initiating because you don't know how it'll go, it's possible to find sexual pleasure and sensuality even in the context of low desire or changes in libido, if you will. And so as a couple, you can redefine your sexual activities to include new or maybe forgotten activities that you had early on in the relationship. So making a commitment to sample, if you will, or I just say experiment. You can try an experiment, because you don't have to commit to a behavior, but you can try something different. And if it doesn't work, that's fine. Now you know. But being able to sample maybe sensual or pleasurable activities without the pressure to achieve erection, intercourse, or orgasm can feel like a bit of a weight, like a relief of, okay, there's no pressure of having intercourse. We're just trying something different and seeing what happens. So when I say communication, this is the kind of communication I mean, being willing to openly discuss desires, concerns, those types of things with your partner, and talk about what matters to the two of you, committing to a plan to help maintain that connection. So when it comes to keeping intimacy alive or keeping that connection, when we say intimacy, I'm not just talking about sexual intimacy. There's also emotional intimacy, sensual intimacy, sensual activities such as a back massage or having a bath together. Those are small examples, but there's a wide range of things that can be affectionate and close and sensual that don't have to involve intercourse. A piece I've got just at the bottom there, so special exercises. So this idea of a sensate focus. So sensate is something that I teach, or an exercise that I'll go through with clients quite often that increases. It's nice that have someone touch you and get relaxation from that, but what it can really do is increase a person's confidence in noticing maybe the different sensations, or noticing or exploring their partner's body or even their own body in a different and new way, and it creates a sense of comfort. And so smaller activities that don't necessarily need to be this big presentation of sexual intimacy, but smaller things such as like a sensate focus or more non-sexual activities can help almost act as a ladder up into, to get a variety of experiences, a variety of tools under your belt. So the top quadrant there is, okay, so how do we have these conversations? We're talking about communication, we're talking about connecting as a couple. How do we even start those conversations? They can feel really, really nebulous, ominous to even broach. So it's a really good rule of thumb is to start with communications about values. What is the importance of it? It's not just oh, we haven't had sex in a long time, or oh, I want you to do this with me. It's about value. So and the example I have up there that you can't read is, I still value being intimate, sexual, sensual with you in some way. So the value is being close, being intimate. From there, we can look at, okay, so then what does this look like, the next step? What did I write there? I would like contact. That doesn't have to be intercourse. So having a few examples or a few go-tos or a few places to start that don't have the pressure of intercourse is a good place to start. Then the third portion here is, strategies. If you're wanting to try something different, or even if you're wanting to address a current pattern that's happening that you'd like to shift, would you be comfortable trying blank, something new, something different? So it seems very simplistic, just writing it up like that. But the 3 steps that can be helpful to keep in mind is communicating value. What is the value? What is important about what you're asking? What could it look like? Offering a suggestion and a strategy. Again, this is what I'm thinking. Like, what would you think about trying something like this or something new? So the next few slides, I've got a few examples of ways that you could, or a conversation could be started, or conversations to have with your partner. And these next 3 slides I've taken from a table in the ADT, androgen deprivation therapy manual that was co-written by my supervisor, Dr. Walker. This first one, so examples that a patient, so yourself, maybe could ask your partner. So what should we do when I get aroused or you get aroused and I don't? Is it okay if I bring you to climax or orgasm through oral versus maybe intercourse? How would you feel about me exploring or using some of the ED treatments or some external enhancers? Other things that may be a good, that could be helpful to ask or helpful to get those conversations going. Do you still enjoy me touching you even though you don't get fully aroused? Or what kinds of touching do you enjoy most now? So for partners, if as you're wanting to understand a little bit more of, okay, how do you approach then your partner who has gone through prostate cancer? And just this third page here, are you comfortable, or one of us? Just, yeah, one of us reaching orgasm even though the other doesn't. How do you feel about touching, caressing, and how do you feel about acquiring a sex toy? A lot of patients I'll see, this is kind of the first time that they've maybe had that conversation about bringing something in to enhance their sexual experience. A note to remember here, so attraction and desire are not limited to sexual activity. I mentioned it a little bit earlier as well, but just to reiterate, showing appreciation for each other's company and closeness in non-sexual ways can really go a long way in bringing a sense of closeness and connection. One thing I talk to my couples in therapy about quite a bit is oftentimes, now this is a very broad stereotype, but oftentimes what I'll notice is that the male partner feels, as I said earlier, feels most connected to their female partner during sex, and then the emotional closeness kind of carries on after. Versus often we'll see the opposite for women. There'll be an emotional connection that needs to be present for the female partner to want to engage in sexual activity, and so that's what this slide I was referring to with that of if there is a culture within the relationship of appreciation, affection, and letting each other know that can help create the context for wanting to be closer in different ways. Making your partner, I have a note on a note here for myself, making your partner feel appreciated by doing things that require some sacrifice on your part. So an example I received from one patient was, I love to make cabbage rolls for my partner, even though I do not like them for myself. I know that they enjoy them, and so I choose to happily make them for my partner. I have a lot of people say, okay, so what are non-sexual things, Chelsea? Are you just talking about holding hands in public? Sure, I mean, that could be part of it. But I've also broken down four maybe different ways that one can experience or cultivate non-sexual intimacy within their relationship. So the first one, and one that people usually catch on to, is that intimate, sensual, physical touch that doesn't need to be sexual. So yeah, that could be where the hand holding comes in. That could be where the caress on the shoulder, the massage comes in. That doesn't need to be necessarily sexual, but it conveys affection, it conveys appreciation and closeness. The second category we have here is the disclosures. So sharing with each other how you're feeling and what you're going throughout the day. Not holding back because you think you'll burden the other people with the emotions you'll bring up, but sharing maybe interesting things that you're thinking about, exciting things, or things that brought you joy throughout the day, even if in your head you kind of might judge them as being boring. Well, that's not that interesting. It's still bringing a communication, a day-to-day communication that you don't always have with other folks. The third category is rituals of connection. So this can look like, sometimes when sexual touch is no longer practiced, other intimate forms of touch also go by the wayside. So consider daily, weekly practices that you can make or already have made a habit or ritual to keep you connected. And what I mean by that is this ritual of connection is things that you do on a regular basis that intentionally bring you together, whether it's a kiss when one of you goes out or one of you comes back, whether it's an I love you, good night, but something that reinforces the romantic and intimate partnership between the two of you, something that you don't typically do, again, with other people. Maybe cuddle time on the TV before bed could be a ritual, or a long hug. So this fourth area here, so quality time. So protected time that is intentional activities or conversations together. So quality time, it might be running errands. It might not be. Some folks I find, they really enjoy it. It can be fun running errands together. Other people find that's the bane of their existence and they'd rather do anything else. So whatever you decide can be quality time, but prioritizing and set up ahead of time rather than just defaulting to filling the gaps. So planning ahead, considering what you're doing, considering the conversations that you might like to have, activities you maybe might like to have. Maybe it's things you both enjoy, or you or your partner wants to introduce you to something they've been learning or something new. But the key with this one is that intentional quality time set aside for each other to be able to connect. So again, I just have here another potential rubric framework to have these kind of conversations. So if you're wanting to discuss these areas with your partner, brainstorming examples together of what that could look like. And with brainstorming, you're not committing to anything, but saying, hey, yeah, maybe it could look like this. Or I thought of, maybe this other thing that we could introduce into our daily routine. Checking in with values. So again, back to the previous slide of, what is important about this for you? What is important about these activities? What do you want to highlight? What are the reasons that these specific actions have importance to you and the relationship? And setting in specific intentions. So it's very hard to achieve goals or know where we want to improve if we don't specifically kind of identify or write down what they are. So you might say, we should bring more intimate touch or bring more rituals into our week, and the conversation end there. Chances are that's not going to happen unless the two of you say, okay, well, these are some specific things that we could add in. Let's plan for that this week. And then setting a plan for follow-up. Maybe it's, a monthly check-in of, hey, we talked about doing these things differently last time. How do you feel that's going? This is what I've noticed. Maybe it's a weekly follow-up, monthly, finding something that works for you. But seeing how you're doing in that connecting piece together. So that is the end of the, meat of the presentation. Really, it's meant to be maybe a bit of a sampling of the types of things that in therapy we might address, or my intention was to give you at least something to kind of start with, to work on at home if it's something that interests you. There's lots of other ways that, if we were to meet in therapy, that these could go. In terms of sexual response cycle and different ways of having these conversations, or maybe looking at maybe there's some beliefs that are really rigid and set up that you're having trouble letting go of, so unpacking some of those. But this is meant to be a framework of, okay, this is a good place to start, maybe starting some conversations or thinking about some things that maybe you haven't discussed with your partner before. And so we at Walker Psych, we offer webinars and workshops time to time as people are interested. And so we've been thinking of developing maybe a wellness webinar specifically for men. We have quite a few resources for women, but if a sexual wellness webinar is something that would be of interest to you, this QR code is basically a sign-up sheet, or just something to signal to us that there is interest. So if that's something you're interested in, you can scan that. It'll be part of the slide pack that Rhett will get. Yeah, that's that. This one, so this is the pamphlet we have for our women's health workshops. So talking about vaginal and sexual health workshop, there's the QR code there for that one. If you think any of your partners might be interested in that, Dr. Lauren Walker is the one who leads that one, and it's via Zoom, so it doesn't have to be in person. Camerons don't need to be on if that's not something that your partner is comfortable with, but she covers quite a few different topics there. Again, conversation starters, things that are good to know, and maybe some things to think about or explore more for the individual for themselves. These are the not advertisements, I guess maybe they are, the blurbs we have for our prostate cancer groups. So our groups are offered on a monthly basis. So they're workshops. So these ones are led by myself and the nurse practitioner. May or may not have had emails from Lexi, but her and I are the ones who facilitate these ones at the center. So caring for caregivers, so that is more geared towards partners, whether it be, spouses or family members or friends who have been caregivers or have been helping a patient out. So normalizing the arduous role that caregiver is in, and strategies on how to maybe promote self-care throughout that process. And the second one, which is a very popular one, caring for couples. So that one's a couples workshop that elaborates a little bit more on some of the things that I've talked about today. And there is more of I don't want to say it's not a support group, but it's more interactive than maybe, didactic me talking to you. So that one we do encourage people to have conversation with each other. And there's a couple exercises that we go through within the session. And honestly, we have a lot of fun. I really like that one. It's a ton of fun. So you may be eligible for some of those services or some of those support systems still at the PCC. Feel free to reach out to Lexi. Her email address is there if you're interested in knowing more about those. And we have, like I said, it's usually the third Tuesday of every month is when we offer those workshops. And then there's just my contact information in the same QR code if you have questions for me specifically that you don't want to ask in the group, or you're wondering about maybe different aspects of counseling or our website. That's my contact information there. So that is it. I'm happy to have questions if you have any.
Hi, my name is Stan.
Hi, Stan.
2013, I was diagnosed. I finished my treatment in 2014. And shortly after that, my testosterone completely went down to zero. Mm-hmm. My desire vanished. Yeah. My memories also disappeared. In other words, I guess I went through a process where, without those memories, it really affected the pills and the needles, and they were a complete failure. The last thing I was offered was the implant, mm-hmm. And my question, to the medical people was that why? I'm at a point where I absolutely have no desire, mm-hmm. and no interest. And when my testosterone disappeared, my estrogen levels went way up, mm-hmm. and that's who I became. Mm-hmm. So I went through a process of it's almost like puberty, with the estrogen.
Describe that, yeah.
And then when the estrogen went down, testosterone started coming back, and I went through another form of puberty as well, along with the menopause. And that created a whole bunch of stuff up in the brain where, mm-hmm. at this point, I have absolutely no interest in even pursuing it. My partner was lucky; she went through menopause, so she wasn't really affected by it. But I've been searching around for any information as to what it is, and I absolutely have no idea where to go. Mm-hmm. And if anybody's working in those areas, because I have a lot of experience with it, that I would like to share, but there's just no place to bring it.
Yeah, I definitely hear you with those hormone changes. It changes the way we experience emotions, the way we experience and interpret the world around us, and our sense of self even can be affected by that. So yeah, I hear that. I think that the description that you used of kind of going through puberty, yeah, I could definitely see how that would be the case, and that the drastic changes that you would go through. I don't have all of the information on this in my head right now, but there are resources through the PCC in regards to the androgen deprivation therapy. Now, that might not have been something that you went through specifically, that treatment, but what you're describing here sounds similar to some of the effects of that treatment. And so I wonder if maybe reaching out to the PCC and asking, okay, what sort of resources can you offer in terms of, this avenue or this the hormonal aspect, they might be able to provide you with some. Because I know there are some classes and there are some groups that specifically target the hormonal changes that can come with the hormone therapy. But yeah, it's such a tough process to go through. And a common thing that I hear from folks is they're never really fully prepared, even if they've chosen to do the hormonal treatment pathway. The changes, it's one thing to know about them, but then going through them, it can feel totally different, and it can be very frustrating and confusing. So yeah, thank you so much for sharing, Stan. Yeah.
It stands from Fort McLeod, so
Okay.
yeah. So you have access to email. Stan might be able to email you.
Yeah, and I forgot to also mention, I've got some of our cards here that have information on them, at least contact information and things that we have workshops about. So if you don't have anything to write down, notes with, you can grab one of those, and we can direct you in the right way if you need to.
Steer the right direction. Yeah. Obviously not here every day to access resources.
Yes.
So
Yeah.
it makes it difficult. I know Rhett's been monitoring our Zoom. I don't think there's any questions in the chat, so.
No, we're good. Yeah.
Awesome. And like I said, if you have further questions, feel free to reach out by email. I answer those fairly regularly, I think. But yeah.
Yeah, we could flood you with emails.
Yeah.
Yes.
You've got some of your cards,
Yes.
information things, so.
These are the same ones. I just one on each side.
Antonio, maybe you could grab a couple of those or few to put into our resource library. Great, that was wonderful. See, I learned something every month when we come out. And tonight was no exception, so that's good. On behalf of Prostate Calgary, I'd like to present you with a little gift bag just for sharing your time with us tonight. We appreciate that
Thank you so much. Oh my goodness, what a treat. Thank